Hi there. So my name is Dr. Joshua Muggleton. I'm a clinical psychologist with the Fife Child LD team. And I'm here today to talk to you about the FNDQ, or Fife Neurodevelopmental History Questionnaire. Now, like all big NHS projects, this isn't about one person. There's been a huge number of people who have helped contribute to make this what it is. Hopefully I've named most people there, but if there is anyone that I've forgotten, I do apologise. So let's start off with thinking about, well, what's currently going on. And what we're seeing across Scotland is this move towards neurodevelopmental pathways. And I think this is a great thing. I think it's going to lead to a more joined up approach, which is going to mean that we're not just being multidisciplinary, but we're being multi-diagnostic. And we're kind of recognizing that there is this overlap between neurodevelopmental disorders, and that some of these kids might not easily fit into one or other diagnosis, and we can take a much more holistic look at a child's needs and making sure that we're meeting them in the best way we can. And hopefully this will also save children bouncing around from waiting list to waiting list. However, there is a problem with this. Our current diagnostic tools are built around there being about pathways for one condition. So for example, if you look at autism, the ADI and 3D ask, what is the evidence that this person is autistic? So these are really good at confirming whether or not someone has a diagnosis, at trying to gather that evidence. But it's not something that you can give every child on a diagnostic pathway, along with an ADHD assessment and a learning disability assessment and an assessment for everything else. They're really far too in-depth for our needs. We need something a bit different. And if we look at screeners, well, these are much easier to give to every child, but there's still overlap between neurodevelopmental conditions that can create false positives. So in my work with children with a learning disability, if I give one of my parents the copy of the SNAP-4 to look at hyperactivity and impulsivity, but quite often they'll score quite high. And that doesn't necessarily mean that a child has ADHD. It might mean that they've got sensory issues. It might mean that they've got anxiety, or it might mean that there are underlying issues with hyperactivity and impulsivity. So they're quite a narrow focus, and it doesn't really give us the whole picture of what's going on. So neurodevelopmental pathways need a tool that assess all areas of child development, not just one or two areas at a time. And these don't actually need to be diagnostic. We already have really good tools for that. But what they need to do is provide the context and to provide enough information to point us reliably in the right direction, to help us build a bit of a formulation, to explore what's going on and decide what we need to do next. Another problem we have with neurodevelopmental pathways is that multidisciplinary often means that multiple professionals are taking the same developmental history. So this can either lead to parents having to give the same developmental history over and over, and each new professional might ask a few professional-specific questions, but a lot of the time they're asking the same kinds of questions. Or it can lead to the situation where you're using someone else's developmental history. And this is really good, and there are great developmental histories out there. But there's a risk sometimes of confusing absence of evidence with evidence of absence. So for example, a common example that we use for this is fetal alcohol. Have parents been asked about alcohol use in pregnancy? It's very easy to assume that if you have a really good developmental history and that's not mentioned, that presumably this child wasn't exposed to alcohol prenatally, but you don't know that. You don't know that someone has actually asked that question and that there wasn't anything worth commenting on. The other issue is that if you have lots of professionals that are used to working on diagnostic pathways for one condition, it's sometimes tricky to know what to ask for different conditions. So my area of work tends to be children with learning disability and children with autism. So I feel pretty confident assessing those. And while a lot of the children I work with have ADHD, for example, I don't feel as confident assessing ADHD. I don't know quite as well what are the questions that I need to be asking. How do I work out what's ADHD and what could be something else? I've not got that experience and that expertise. And yet in a multidisciplinary pathway, we might be relying on someone being able to take any child with potentially any kind of neurodevelopmental disorder and be able to unpick those. So what we're proposing and what we've put together to try and solve this problem is the Fife Neurodevelopmental Questionnaire, or FNDQ. So the FNDQ is a structured developmental history taking tool for neurodevelopmental disorders. It's multidisciplinary with inbuilt expertise from multiple professionals from lots of different specialties. And that's actually not just neurodevelopmental disorders, but also, for example, dietetics and epilepsy, and other groups where we know that the kids that we work with often have contact. It really aims to be holistic. We want to look at, well, what has this child's environment been like? Because that's going to have a huge effect on their development. We want to know what's going on in this child's life right now, and also what's happened to them already. What shaped the child that we're seeing in front of us today? It's neurodevelopmental because we try and consider all aspects of child development, and we don't focus on any one particular neurodevelopmental disorder. And finally, and this is the big selling point for parents, is that it's one history. It's one history which has all of that important information that contains pretty much all the questions that parents are likely to be asked in terms of a general developmental history. And we share it in one place digitally so that any other professional who comes into contact with the child now or in the future has access to that. Now, we might still, after doing an FNDQ, we might still say, okay, we need a more in-depth autism-specific history. And so for that, you might be using things like your ADI. But there'll be some questions that have already been answered. But for the most part, you'll be using the ADI because you've already got good evidence that autism is perhaps the most likely explanation for what's going on here. So the FNDQ at its heart is a formulation tool. So it's not diagnostic. It doesn't churn out a number or a diagnosis. And equally, it's not a screener. It's far too long to be that. But what it does do is it gives us a good developmental history. It's a history-taking tool. And it allows us to understand what are a child's current difficulties, and it gives us the basis on which we can build a formulation. We can then use that to identify, well, what are the questions that we need to answer in terms of this assessment, and plan our further assessment, plan our intervention, and any results that we get from any more in-depth assessments, we can then embed that in a much broader context, and we can make sense of those results properly. The FNDQ is a tool for children, although there are some discussions about if we could create an adult version. And similarly, it's a health tool, although it's been discussed, could we create a version for education use? So in terms of using the FNDQ is something that's done jointly between parents and clinicians. It's a collaborative process. So the way that I tend to use it is to give it to parents to complete ahead of their next appointment or before their first appointment, and to have a go at complete what they can, but there's no pressure to have it perfect. To bring it back to clinic, and then we can review that together and go through, we can finish it off together. And that means that if there are anything that I'm not sure about, or I want to get a bit more detail on that they've written about, I've got the chance to do that. It means that if there's stuff which is quite straightforward, I've not really got any questions, I can see that and we can skip straight through that. And it also means that if there's anything that parents are a bit unsure about, they don't know how to answer, or something's a bit sensitive and they want to put it into a broader context than they might be able to put on paper, they've got the opportunity to do that then. It can also be used as a structured clinical interview. One health board used it very much as something that the clinicians go through with parents to structure their process. And equally, it can be something that's sent out to parents to send back in. But the important point is there is that opportunity for clinicians to go through, ask those follow-up with parents, and for parents to get help filling it in, because it is a long form. And as well, while we try and make it as simple language to use as possible, and we try and make it as user-friendly as possible, it's important parents have that ability to get any support that they might need. We often use the FNDQ when we want to check for other possible reasons for a child's difficulties. So, for example, what could anxiety be playing a role here? Are there any underlying health issues? Have they had any difficult experiences? We might use it when we want to work out what are the other possible neurodevelopmental issues that might be going on. And this is the essence of why we developed the FNDQ. But it's also very helpful, particularly for children where they have quite an unclear or quite a mixed profile. And it's not a child where you read a bit of history, you speak to parents and you're pretty sure early on this is the route they're going to be going down. It's also useful when you want to work out, is there a neurodevelopmental issue going on? My colleagues who are in CAM services where there's less of a neurodevelopmental focus, it's more about mental health. Often a lot of kids with neurodevelopmental issues attend CAM services. they might not have been diagnosed yet, and after a few sessions, the clinician might start to think, oh, actually, I think there might be something else going on here. And having the FNDQ is a nice way to kind of structure to go through and think, well, what else could be going on with this picture that can kind of augment their existing formulation skills. And lastly, it's a really useful thing to use when sometimes you don't know where to start. If you have a child who comes through the door and actually there's so much going on and you're trying to think, how do I get a handle on this and work out where to start? Sometimes people find going through the FNDQ is a really useful way to think about what the priorities are for the family, what are the maintaining factors in what's going on for the child, and what other assessments might be helpful. In terms of how we developed the FNDQ, it was very much an iterative process. So we started with having meetings with senior professionals from lots of different disciplines and specialties, and really asking them what questions do they ask during neurodevelopmental assessments and why. And what we're trying to do is identify, well, what are the common questions that are common to all professionals? And are there questions that are unique to certain, so are there certain questions that are unique to certain specialties that we need to ask, but that other clinicians aren't going to ask? So what are the essential ones that, for example, a pediatrician would ask that a speech and language and a clinical psychologist wouldn't ask? So based on that, we created version 1.1, and we kind of test that out with some of our own children and with some complex cases. We just checking, does this make sense? Is there enough room to complete it? Is it practical to use? And we made some minor clarifications. And then from that, we rolled out version 1.2 of the FNDQ. And that was back in January 2019. And from that, it became quite quickly a core part of community paediatric services in Fife, the ADHD, ASD, and learning disability assessment pathways. And it was also used sometimes within child development centres, CAMS, speech and language, OT, when it was thought that this could be a useful thing for them to do. Throughout that time when it was online, we had regular feedback from clinicians. And then in the last few months, I put out a call for feedback as we were starting to develop version 1.3. And version 1.3 was a big change. So one of the perennial difficulties with the FNDQ is because there's so much to cover in terms of child development, not just neurodevelopmental, but also any health issues, any social issues. What has this child had any difficult life experiences? With so much to cover, it's a very long form. And so we're trying to think of how do we make this shorter. So one of the things we did is we got permission to use the questions from the FNDQ developed by Chris Gilberg as kind of gateway questions for a lot of the form. And so it means that there are a lot of areas or a lot of sections where there might be one or two compulsory questions, then the FNDQ question, and if they answer no, there aren't any concerns in this area of development, that's it, they can skip to that whole section and move on to the next one. We also made pretty much all the questions either yes or no with space to elaborate, just so it meant that parents can, it's a bit easier for parents to quickly go through areas that, where there aren't any difficulties. We had a change from how old was your child when they developed a certain skill to did your child seem late? And this was based off some research which indicated that parents tended to have difficulties remembering exact ages, but were much more accurate in remembering if a child seemed late. And so we decided it's probably more useful to ask, well, did a child seem late? Because actually that's what we want to know most of the time. We looked to improve the pregnancy and alcohol questions, as this was around the time when the signed guidelines for fetal alcohol were being released. And so we were trying to incorporate some of that into the FNDQ. And we included some epilepsy questions and some feeding questions. And so we rolled out version 1.3 in the summer of 2019. And we also had involvement from Scottish Health Innovations Limited, who set up an inter-service copyright agreement. And this meant that we had two other health boards who were interested in using the FNDQ, and it basically granted them a free license to be able to use the FNDQ within their services. And that's been really helpful as well, because it's given us some external feedback about how other health boards do things. And one of the pieces of feedback was the need to have something that's more digital. The FNDQ 1.3 is a paper-based form, and so it's something that has to be printed out. You write on it, you have to scan it in. And actually, people were rightly saying, could we have something digital? So we created an electronic PDF form that can be typed directly into. We're now about to release version 1.4, which we're really excited about. We've had lots of great feedback from external health boards, but the really big change for us has been that we've now had direct parent feedback. We were hoping initially to run focus groups, but obviously with lockdown that wasn't possible. So instead we had parent interviews over VC or over the phone of parents who had looked at the draft of 1.4, said they liked this, they didn't like that, why don't you ask this question? And they gave us so much really useful feedback. And so we've really tried to incorporate that in version 1.4. And we've also got another 2 health boards who are waiting to use 1.4 when it's released. So some of those improvements have been further refinements of pregnancy and attachment questions. We've got a whole new section on tics, which is really good. We've also set up questions much better for children who have been adopted into families, and kind of looking at some of the ethical and the legal and the emotional issues around how we sensitively gather information about, for example, birth parents and birth families. We've added more space to answer questions. One of the things that we were thinking is this is a really long document, so let's shorten it, let's try and cut out space. And actually parents were saying, no, we want a bit more space so that we can give you the detail we want to give you. And we improved our feeding questions as well to include things like PCARE and anxiety around feeding. What we're really excited about is we're exploring ways to create an online form of the FNDQ. We're doing that with Scottish Health Innovations and the Scottish Government. The idea is that this would be a web form version of the FNDQ, which would be so much easier for families to complete because it's something you can do on your phone, on your tablet, on your computer. You can do it on the go. We can also make it adaptive and dynamic so that, for example, we have the FNDQ gateway questions, and we can have perhaps those questions at the start. And then based on those answers, you almost build your questionnaire for your child. So it should make it a lot less daunting and much more tailored and specific to the child. It gives us the option to add things like a help button with guidance, or to add audio and video description for people who find reading difficult. If we can make it compatible with things like Google Translate, it means that we don't have to worry about having to get the FNDQ translated into other languages, or having a translator go through the FNDQ with a family. And it would allow parents to really to more easily update the FNDQ in the future. One of the things we say is that you should only have to complete the FNDQ once for a child, but we might ask you to update it. And so currently that means that we would print off this annotated version, ask them to write further details on there with extra space, and then we have to rescan that. And that's a bit messy, but if we have this online version, then we can select what sections do we want people to update, because things like pregnancy, you're probably not going to need to update that. And then we can get much more detail, and we can see how things have changed between when it was FNDQ was completed, let's say in 2020, to when it was completed in 2025. And we can see in those 5 years what has changed in this child's presentation. What this would also mean is that behind that web form, there would be a database, and that if we had the correct clinical governance in there, the correct ethical permissions and considerations in there, that could potentially be a database of enormous depth and breadth and size to look at children who are developing differently, who have to look at child health, to look at social issues, and really give us a huge leg up when it comes to public health policy planning and informing research. So we're really excited about the possibility of being able to create something like that. In terms of other steps that we need to do, we need some evaluation. Evaluation is going to have to be about utility as opposed to validity. Like I said at the start, the FNDQ doesn't just churn out a number or an answer. It's a tool for gathering a developmental history. So really it's a question of, well, how useful is this? Both for parents and clinicians. How long does it take parents to complete? When we did the focus group, if you're interested, parents were saying generally somewhere between 90 minutes and 2.5 hours for most children. Some of the very complex children, it was taking more like 3 to 4 hours. Although actually parents said that they were quite happy to do that because of that guarantee that we were saying we're going to put this on your child's electronic record. It means you're not going to have to do this again. And lots of parents were saying, well, actually, we've had to do this so many times. Having that one form will be such a relief and so worthwhile, being able to take the time to really tell you everything about a child as opposed to just looking at one bit. But yeah, in terms of evaluation, also looking at, well, are some questions more effective or more useful or more essential than others? Are there things the FNDQ doesn't capture that we need to refine? So I think that's going to be the focus for how we evaluate the FNDQ going forward. So the last thing to say is, if you've got any questions, feel free to email me. Equally, if you think you might like to use the FNDQ in your service, great. The FNDQ is free to use, but we do require a license agreement to be set up between your health board and Fife. But if you email me, I'm happy to send you a sample copy you can look through, and the details of how to take that forward if that's something you'd like to do. So yeah, thank you very much for watching.